Hello, everyone. My name is Brandon Fan. Today I'll be going over reproductive cancer, specifically prostate, testicular, ovarian, and cervical cancers. And this presentation is based on the research I did in Biology 54, um, Human Understanding, in the course with Dr. Mary uh, Poffenroth. Um, and I'll be covering the biology behind the cancers, new treatments, awareness issues, and why this topic personally matters for college students like us. Um, so on today's agenda, here's what we'll be covering over today. First, I'll talk about what is reproductive cancers and who do they affect. Then I'll go into current statistics and screening guidelines. Next, I'll go into two biological factors such as inflammation and genetics. And then I'll highlight new treatments, especially for ovarian cancer. And then we'll look at awareness and fairness issues. And lastly, I'll talk about why this topic directly matters to us as college students, and what actions we can take. Yeah. So, what are reproductive cancers? Reproductive cancers occur in the organs involved in reproduction, such as prostate, testes, ovaries, and cervix. And these cancers can impact fertility, hormonal imbalance, sexual health, and emotional well-being. Many reproductive cancers are internal, so symptoms may not appear until later stages. And this is one of the major reasons why early screening is extremely important. These cancers are also physical, emotional, and a financial strain, not only on the patient, but on families. And compared to breast cancer or lung cancer, reproductive cancers receive less attention and funding, which affects the awareness and outcomes for these cancers. So, who do these cancers affect? Prostate cancer mainly affects men over age of 50, while testicular cancer occurs most commonly in younger men between 15 and 35, which includes college students. So, ovarian cancer risk increases with age and certain genetic backgrounds. Um, Cervical cancer is strongly linked to HPV, which is common and it's common among sexually active young adults. So even though these cancers affect older adults, some risks begin in young adulthood, and prevention of these cancers is what really matters. So if we take a look at the latest stats or trends, some of the stats I found was that this year there are an estimated of 313 new prostate cancer cases in the US, with about 35,000 deaths. Prostate cancer also affects groups differently. For example, Black men do face 70% higher incidence and nearly double the mortality rate compared to white men. On the positive side, the HPV vaccine has reduced cervical cancer risk by over 80% when it's received early. And among young women ages from 20 to 24, cervical precancers rates have dropped almost 80% because of the HPV vaccination programs. However, for prostate cancer, we are seeing more cases being diagnosed at later stages, partly due to inconsistent screening. So now I'm going to talk about some of the biology. I want to talk about inflammation and CXCL1. A major biological factor in reproductive cancers is inflammation. A molecule called CXCL1 promotes cancer growth, blood vessel formation, and spread to nearby tissues. It does this by recruiting cells that are supposed to fight the cancer, but instead, it ends up protecting the tumor. So in these cancers, the immune system can actually be tricked to helping the tumor grow instead of fighting the tumor. I'm going to talk about genetics next. Genetics also plays a huge role. A common genetic variant, such as the RS3820282, increases the expression of a gene called WNT4, which helps the uterus become more receptive for pregnancy. This is beneficial for like fertility, but it also may also increased vulnerability to estrogen-related cancers like ovarian cancer. Um, and this goes to show how biology sometimes trades fertility advantages, um, and it ends up actually helping the long-term cancer risk. So some of the treatments that's happening today and is the PARP inhibitors. So a major advancement in the development of PARP inhibitors such is olaparib, niraparib, and rucaparib. And these drugs work best in patients with BRCA1 or BRCA2 gene mutations because they exploit cancer cells in their DNA abilities. These treatments have extended like the survival rate for patients, especially in ovarian cancer. However, these tumors can eventually adapt and develop resistance, so research is still ongoing. Next, I want to talk about awareness gaps in social media. So, breast cancer, as we all know, is very highly visible due to its campaigns like Pink October. Meanwhile, prostate and testicular cancers receive far less public attention. This lack of awareness means fewer people know warning signs, and it affects the screening time as people aren't getting screened as early. Um, Social media also plays a huge role in shaping these cancers, and then it shapes how what we see as which cancer gets the most important, which impacts funding and survival outcomes. So one of the biggest ethical issues related to reproductive cancers um, is unequal access to early detection and care. For example, Black men are diagnosed with prostate cancer at significantly higher rates than white men, but often face barriers to screening and treatment due to systematic inequalities in healthcare. Another issue is misinformation, especially around the HPV vaccine. Some people believe that vaccine is only for girls, which prevents many young people, especially men, from receiving a vaccine that could prevent cervical cancer almost entirely. There's also ethical concerns about genetic testing, such as BRCA testing, learning that you have a high genetic cancer risk not only affects you, but also your relatives, and this can cause a emotional and um, privacy implications to you and your family. Lastly, clinical trials often are underrepresented. Um, they underrepresent certain racial and cultural groups, meaning treatments aren't always optimized for everyone. Um, and promoting equitable access, accurate health communication, and diversity in research is essential for improving these outcomes across all reproductive cancers. So you all must be wondering, why does this matter to college students? Testicular cancer is most common in our age group, so many college students are still within the ideal range window for completing the HPV vaccination. Um, it's important that we understand and know our family history, um, s- as it's often something that we don't think about. And engaging in those conversations early on really does matter. Um, and it's important to simply just normalize these discussions about reproductive health as it can save our lives. Prevention and self-check. So, um, here are some steps that I listed out. I would say to complete your and check your HPV vaccination status. Follow cervical screening guidelines if applicable. Practice testicular self-awareness. Report painless lumps or swelling early. And then just having small lifestyle habits such as regular exercise, no tobacco, and moderate alcohol can really reduce the overall risk of these cancers. Um, so it's overall just it's really important to listen to your body. If something changes, get it checked and tell your doctor. And then for the conclusion, I just want to say in summary, reproductive cancers are influenced by biology, genetics, and social awareness. There are new treatments like PARP inhibitors, that are still in progress, but it's important that awareness and access, uh, s- that it's important to think about the awareness and access, um, as it will really determine the outcomes. And as a college student, small steps like vaccinations, health awareness, and open conversations can really do a meaningful difference. Um, that is it for my presentation. I hope you all liked it. Thank you all for listening.